You've probably heard it a million times. Giving birth is a marathon, not a sprint. And yet, for so long, the medical world treated it like a race against the clock. Well, today, we're going to talk about a completely new, evidence-based roadmap to labor that basically throws that old rulebook out the window. It's all about focusing on your well-being, not some arbitrary deadline.
This question. It's the source of so much anxiety, isn't it? Am I progressing fast enough? For decades, labor was framed as this frantic race. But what if I told you that whole way of thinking is based on, well, really old science? What if your body has its own unique timetable? And that's not just okay, it's perfectly safe.
And this really gets to the heart of the change. The old rule book, and we're talking data from the 1950s here, viewed labor as this rigid, straight line. You had to hit your marks 1 centimeter per hour, like clockwork. But the new science, it shows us that labor is much more like a gentle curve. It starts slow and then naturally speeds up after you hit about 6 centimeters. The whole focus is shifted from watching the clock to watching over the mother and baby.
So, to really appreciate why this new approach is such a game changer, we have to take a quick look back at the old system. Let's dive into what we call the outdated labor clock and the obstetric rush it used to cause.
Okay, so in the old days, the main tool was this chart called the partograph, and on this chart was the dreaded alert line. If your progress dipped below this line even a little, it would often set off a whole cascade of events. Suddenly, there were interventions, maybe breaking your water or starting a drip to make contractions stronger. And this pressure, this rush, all too often ended with a diagnosis of failure to progress and a C-section that, looking back, might not have been needed at all.
But here's the good news. There is a much, much better way now. So let's talk about the solution. Labor's new roadmap, which is officially called the WHO Labor Care Guide.
So, what is this labor care guide? You can think of it as a complete philosophical reset. Instead of that rigid timeline, the focus is on the holistic well-being of both mom and baby. See, the goal isn't just a safe delivery anymore. It's what they call a positive childbirth experience. That means your emotional comfort is now considered just as important as your physical progress. It's a huge deal.
Okay, so how does this guide actually work when you're in the labor room? It's not about throwing monitoring out the window, it's about monitoring the right things. The whole system is built on 4 key safety pillars that, when you look at them together, give a complete, accurate picture of how things are really going. So here they are, the 4 pillars. First, you have the baby's voice, which is all about the fetal heart rate. Second is mechanical progress, and that's not just dilation, but also how far the baby has descended. Third, the engine's power. So how good are those contractions? And finally, number 4, the captain's state, which is all about mom's well-being. It's like a comprehensive safety checklist for your entire journey. Let's start with pillar 1, which is absolutely the most critical safety metric, the baby's heart rate. You know, a baby can't exactly tell us if they're getting stressed, but their heart rate sure can. A nice, healthy range is between 110 and 160 beats per minute. If the heart rate starts to go outside that range for too long, it's a signal that the baby might be having a tough time, and that's when the medical team really tunes in.
I love this analogy because it totally redefines what progress means. The old way was obsessed with just one number, dilation. But the well analogy shows us that's only half the picture. Think of it like this. Dilation is the opening of the well, but descent, the baby actually moving down the well, is just as important. Progress on either one of those fronts is still progress.
Okay, pillar number 3 is the engine, your uterine contractions. Your uterus is an incredibly powerful muscle, kind of like a sugar sponge, that needs a steady supply of energy to work well. The sweet spot, the target zone, is about 3 to 4 good, strong contractions every 10 minutes. If you have too few, the engine's not quite powerful enough. Too many, and it can start to get too intense for the baby. It's all about finding that perfect, productive rhythm.
And now for pillar 4, which honestly might be the biggest change of all. Your well-being. Your emotional state is now considered a vital medical metric. Why? It's simple, really. Fear creates tension and adrenaline can actually slow down or even stop your contractions. So the new guide is all about breaking that fear-tension-pain cycle with amazing support, encouraging you to move, and making sure you're hydrated. A calm and supported mom is key to progress.
All right, so now that we get the new framework, let's have a little fun with this. It's time to bust some of those common, outdated labor room myths and replace all that fear with some solid facts from the new guide.
First up, the big one, the dreaded deadline. The myth is that you have this fixed window of time to give birth. The reality? Not at all. The active phase of labor can safely go for 12 hours, or sometimes even longer. The bottom line is simple. As long as all 4 of those safety pillars are stable and looking good, patience is the name of the game. Okay, next myth. You have to be stuck in bed the whole time. The reality is actually the complete opposite. Lying flat on your back for a long time can sometimes reduce oxygen flow to the baby. But being upright, walking, swaying on a ball, squatting, that uses gravity to your advantage. It helps the baby move down and can even make things go a little faster. Movement is your friend.
Here's another one you might have heard, that getting a lot of internal exams can help stretch things out and speed up labor. The truth? Exams are purely for gathering information. That's it. They don't actually accelerate anything, and doing too many can raise the risk of infection. So they're a tool to be used wisely, not constantly.
Now, it's really important to understand that this new approach isn't about ignoring problems. It's actually about getting much better at identifying the real problems. This labor care guide acts like a clear safety net. It tells us the specific moments when it's time for the medical team to shift gears from patiently waiting to actively intervening. And these are the clear, evidence-based signs your team is looking for. We're talking about genuine fetal distress, where the baby's heart rate drops and stays down, or seeing thick meconium, which is the baby's first stool, in the amniotic fluid, or what we call a true labor arrest, where there's been zero change for 4 hours even with strong contractions. Or, of course, if mom develops a fever or other signs of infection. These are the real red flags that tell us it's time to act.
So, when you boil it all down, this is the big takeaway. The goal of modern labor care has changed. It's not a race to the finish line anymore. It's about supporting and appreciating the incredible harmony between your body's amazing strength and your baby's resilience on this incredible journey. And there's this quote from a Dr. Prashanth that just captures the spirit of this new approach perfectly. Labor is a marathon, not a sprint. We are here to handhold you through every kilometer. It's all about a shift towards patience, empowerment, and making sure everyone has a truly positive and safe experience.